Hello, Psych 101 students. Welcome to Module 7, Chapter 15, Learning Objective 6, where we will look at psychological treatments. So in this chapter, we'll start with psychological treatments in general, and then we will revisit most of the disorders that were introduced back in Chapter 14 and see which treatments are the best for different types of psychological disorders. In this chapter, the big questions, my mouse is clicking weird. Okay. The big questions are: how are psychological disorders treated? What are the most effective treatments? Can personality disorders be treated? And how can disorders be treated in children and adolescents? So let's begin with learning objective 6. How are psychological disorders treated? So psychotherapy is a psychological intervention that's designed to help people resolve their emotional, behavioral, and interpersonal problems, and to improve the quality of their lives. Therapists generally use psychotherapy to change their clients' patterns of thought or behavior. There are over 400 or 500 so-called brands of psychotherapy, but we will just concentrate on the 7 main approaches to psychotherapy shown in this chart from page 595 of the textbook. In this learning objective, we'll cover the first 5: psychodynamic therapy, humanistic therapy, behavior therapy, cognitive therapy, and cognitive behavioral therapy. Make sure you know what these last 2 are. We're not going to cover them further in this objective, but group therapy is obviously multiple people that get together, that share common problems, and one of the advantages of group therapy is the social support that you can gain by talking with others that have similar issues. Family therapy obviously deals with families, and it tries to heal family relationships. And okay, just know what those 2 are basically are. So let's go to psychodynamic therapy. And psychoanalysis was developed by Freud with the help from Joseph Brauer, and it was one of the first forms of therapy, to be used. It was so Freud, mainly Freud developed this, and through free association, dream analysis, and other techniques, Freud worked to help his clients become aware of unconscious conflicts that were causing them distress. And often these conflicts had their roots in childhood. So the main kind of purpose of Freud's techniques like free association and dream analysis was to get at what was buried in the unconscious mind. Freud believed that we would store traumatic or difficult memories. We would store them in our unconscious because they were things that we didn't want to deal with consciously, and so he believed that growing up, in particular, we would have some negative experiences during our childhoods, and they would get stored in the unconscious mind, and then they would come back to affect us later. They would have an influence on us, even though we couldn't consciously recall these particular memories. So let me go through a couple of his techniques here. In free association, the clients express themselves without censorship of any sort. Freud's idea was with free association was to get the client, just talking, and he would have them talk, fairly rapidly without censoring their thoughts, like just almost like stream of consciousness. Just he would want them to just say whatever was passing through their minds, and to keep talking, and he would direct the clients at times with questions, based on what they said. He might ask more about um, the person's mother or father, or his family life, or so. And he would often kind of steer them to childhood memories, and feeling like that was where the root of the problems stem from. He also used dream analysis, where he analyzed the latent, or which means hidden, content of dreams, believing they provided insight into the unconscious. So he thought that our unconscious reveals itself through our dreams. Okay, and that's psychoanalysis. The term psychodynamic, this refers to both Freud's theory as well as those of his followers that came afterwards. So psychodynamic therapists in general believe that abnormal behaviors stem from adverse childhood experiences, and that symptoms will vanish when clients gain insight into their unconscious material. It was about revealing what was hidden there. And then once you saw it clearly, that that material would no longer cause you problems. Once you knew, were more aware of what was in your unconscious mind, then you could, it wouldn't control your behavior anymore, in a sense. And that's kind of the basis of psychoanalysis and psychodynamic therapy. Just, a little hint on whenever you see Freud almost on any kind of test, I mean, there's probably something in the answer. If Freud's in the question, there's probably something in the answer that includes the word unconscious. And if the question asks about the unconscious, maybe Freud's the answer. I mean, like, those two things, Sigmund Freud, the name, and the idea of the unconscious are linked together, because this is what his whole theory was based on, the idea of the unconscious mind. Okay, let's go on to humanistic therapy. And so this is another, what we call insight therapy, just like psychoanalysis or psychodynamic therapy. Those are insight therapy because, they wanted to give their clients insight into their unconscious minds. This is a different type of insight therapy. Once again, it's called humanistic therapy. Humanistic therapy aims to help people fulfill their potential. Basically, what that refers to is self-actualization, being the best person that you can be. Humanistic therapists believe that human nature is basically positive, and they emphasize the importance of taking responsibility for our lives and living in the present. That is, not attributing our problems to the past like they do in psychodynamic therapy, where they typically believe that everything stemmed from childhood. Humanistic therapy was was much more focused on the present. Take responsibility for your life now, and do what you need to make it better. A humanistic therapist emphasizes the importance of a safe and comforting environment in which the client can pursue greater self-understanding. Carl Rogers, he was the one who developed client-centered therapy, which is now known as person-centered therapy. And it is a non-directive approach that encourages clients to direct the course of their own therapy. Um, to ensure a positive outcome, the therapist must be authentic and genuine to establish a safe and comfortable setting. The therapist uses active listening in order to show empathic understanding of the client's feelings. And the therapist expresses unconditional positive regard, which means that they are completely non-judgmental and accepting of all feelings that the client expresses. The goal is increased awareness, greater self-understanding, and heightened self-acceptance. I really I like humanistic therapies, and I like Carl Rogers' client-centered therapy or person-centered therapy. It's the idea is that the therapist is there to assist the client in the in assist the client in solving the the person's problems. Is they're not there to fix your problems. They're there to help you fix your own problems. And I really like that approach. I believe that, you know, no therapist is ever going to know you as well as you can know yourself. And so they're there to just kind of help to guide your thoughts and to point you in certain directions and just create an a relaxed atmosphere where you can go deep into yourself and talk about things that you normally wouldn't stop to think about or to discuss with anyone. And this can lead you to new insights about why you are the way you are, and how your childhood affected you maybe, or how certain relationships in your life presently are affecting you. And so it's an interesting kind of a non-directive approach where you take the lead in your own therapy in a sense, and they just kind of set the mood and help to guide you along the way. Okay, next we have behavior therapy. Um, so behavioral and cognitive treatments aim to change thoughts, feelings, and behaviors directly, not through insight into yourself, like the first two therapies that we looked at, psychoanalysis and humanistic therapy. They were insight therapies. Remember, this is about, like, you don't know, behavioral therapies are more about just changing what needs to be changed. Like, if there's a behavior that bothers you, then change that behavior. They don't care, like, where it stemmed from. It doesn't matter to behaviors if it came from your childhood or where it came from. It's just about, what are things that what kind of behaviors in yourself do you want to change? How do you want to be different? Let's just focus on the actual behaviors and thinking that needs to be changed. um Behavior therapists assume that a behavior change results from the application of basic principles of learning, such as classical conditioning, operant conditioning, and observational learning. For example, as this picture is showing a man who bites his nails, he could snap a rubber band on his finger or wrist whenever he performs that nail biting behavior. And even this, small amount of punishment will just decrease his behavior over time. So you can actually do something, like you can punish yourself if you're trying to change a behavior. And basic operant conditioning takes over that. If you give yourself a little punishment every time you do a negative behavior, then you'll start to reduce that behavior over time. Um, okay, token economies reward clients for desirable behaviors with tokens to exchange for items. And this is the basic operant conditioning reinforcement technique. Um, it's often used in group settings. token economies get used in classrooms. They get used into um, like juvenile delinquent facilities. Um, anyways, and the idea is that everyone wants to start to win the tokens because you can get cool stuff with them, and so you start to change behaviors, and you do desirable behaviors that can earn you the tokens. Social skills training helps clients with social anxiety. The therapist uses modeling to demonstrate a common encounter with the client's feared object or situation, and then guides the client through the steps of the encounter until he or she can cope unassisted. So this could be something like somebody who's too anxious to possibly go on a date, for instance. I mean, they the therapist would actually, do some modeling of, this is these are the steps of a date, and like just they might actually set up a little uh, something that looks like a restaurant table, and just kind of go through some um, play acting or modeling. And then they would have the therapist would do it first, and then have the client sit down, and they could bring in just a woman to stand in for his potential date, and just have the person practice the things that they might say, and to get them over the anxiety. So like this social skills training is kind of a lot of role play and things like that to get more comfortable in certain social settings. Modeling is based on observational learning principles, and so um, behavior therapy is just about using these learning techniques to, classical operant conditioning, observational learning. Cognitive therapy is a treatment for psychological disorders in which a therapist works with clients to help them change distorted thought patterns that produce maladaptive behaviors and emotions. So this is, as opposed to behavior therapy, cognitive therapy is dealing specifically with thinking. Um, Researcher named Aaron Beck developed cognitive therapy, and he advocated for cognitive restructuring, which is changing negative thoughts into more positive ones. Albert Ellis, around the same time, introduced a therapy known as rational emotive therapy. Um, Both of these therapies come from the 1950s, and they're both similar to each other. So I'm going to just kind of lump them together as cognitive therapy, and not deal with the specifics of each. Just remember, Beck is with cognitive restructuring and cognitive therapy. Albert Ellis is rational emotive therapy. But what both therapies do is that they assume that irrational beliefs or thinking can be replaced by more rational and adaptive cognitions. So sometimes we're carrying around irrational beliefs um, about ourselves, for instance, and if you can change those to more rational and adaptive thoughts, and the person will do better in life. So, as an example, somebody might constantly have the message in their brain that they're worthless. I'm worthless, and I'll never succeed at anything. Now, if somebody's carrying around that thought about themselves, it's going to basically be a self-fulfilling prophecy. I mean, they they're always going to be, judging themselves negatively, and anytime they fail at something or mess up, and they'll remember that thought, oh, I'm worthless, I'll never succeed at anything. And there are people certainly that carry around thoughts like this, and so what they would work to do is replace that irrational thinking with a more positive, adaptive, rational thought. Like, for instance, I have value and will improve with effort. And if you could accomplish that, and you could change somebody from walking around thinking that they're worthless and can't succeed to somebody thinking, I have value. I offer value to others, and I will improve with effort means I can fail and I know I'll do better next time. And so, you know, by changing that one kind of major thought process, it's going to really have, a ton of ripple effects where the person's, not going to give up as easy. They're going to continue to go forward, knowing that they can improve over time, knowing that they have something to offer others, and it, one kind of shift in thinking like that would have major effects on a person's life. And this is the idea behind these two cognitive therapies. And this is what cognitive restructuring refers to. You're restructuring the cognitions, the ideas that a person carries around. So here's a similar. Here's an example of cognitive restructuring from your book here, shown on the screen. So, a maladaptive pattern is my friend did not call me to wish me a happy birthday. Oh, that, and so the person immediately has this thought, oh, she no longer likes me and we are no longer friends. And then this causes them to feel depressed about the event. And this is, pretty common, where, a lot of people will make these negative assumptions based on some event that happened. With cognitive restructuring, the person could change their thinking, and so my friend did not call me to wish me a happy birthday. She was probably busy, and we would talk later. And so the person, is not going to feel depressed about the event. So the outcomes are very different, just based on what your first thoughts are when something happens, like a friend not calling. Cognitive therapy tends to work very well for depression. And once again, this is an example of cognitive restructuring shown here. Cognitive behavioral therapy is a treatment for psychological disorders in which a therapist incorporates techniques from cognitive therapy and behavior therapy to correct faulty thinking and maladaptive behaviors. So cognitive behavior therapy is basically a combination of the last two therapies we've looked at: cognitive therapy in order to change thinking, and behavior therapy to change behaviors as well. It just CBT combines the two, and because if you can change a person's thinking as well as their behaviors at the same time, it's going to lead to a more positive and drastic change. CBT is one of the most effective therapies for many types of psychological disorders, especially anxiety disorders and mood disorders. In this example on the screen here, in this cognitive restructuring example, CBT would also work on changing the person's behavior as well as their thinking. So the example shown here is to get the person thinking differently, that not to assume the worst. The friend didn't call, so must be that she was busy. If it to go beyond just changing the thinking, they would have the person change their behavior. So what would a lot of us do if we had that maladaptive pattern? Oh, she no longer likes me, so we're no longer friends, and they start to feel depressed. They would probably avoid the friend. I'm not gonna call her. I'll wait till she finally contacts me, and if she still wants to be friends, and what they might do with CBT is say, change that pattern. If you can change your thinking to not assume the worst, then you could also change their behavior. Like when you're not sure about how somebody feels about you, maybe give them a call, reach out to them. Be more not aggressive, but be more initiating of things like that, and rather than showing avoidance behavior. So they would work on behaviors that were related to the maladaptive pattern of thinking, and so they work on changing your thoughts as well as your behaviors. Um, CBT works very well with anxiety disorders, um, in particular. I mean, also mood disorders, but really good for anxiety. Okay, so that concludes our look at approaches to psychotherapy, which are focused on, once again, patterns of thinking and behaving and changing them. A different approach is biological therapy. Um, it's treatment for psychological disorders that's based on medical approaches to illness and to disease. Biomedical treatments attempt to directly alter the brain's chemistry or the physiology of the brain in order to treat psychological disorders. So it's not about changing your thinking or your behaviors. It's let's you know let's change the neurotransmitter levels, or change something else within the brain. Psychotropic medications are available to treat most psychological disorders by altering brain neurochemistry, that is, levels of neurotransmitters within the brain. Unfortunately, we don't know exactly why most of these work, which is interesting. I mean, we have a lot of drugs like anti-anxiety pills and antidepressants, and at times we've just researchers have stumbled onto findings that these things, this thing helps to treat depression, or this pill happens to help to treat anxiety. I mean, um, they're not. It's surprising how much they really are misunderstood or not understood well. All we know is that they work. They've been researched, and so if they work, then and the trials show them to be safe, then we go with them. But the precise nature of why they work it often is unknown to us. Make sure you go over these 5 classes of psychotropic medications that are shown in this chart from page 601. Um, we we won't be covering them at this point, so like do look these over on your own and just kind of know these 5 different types. Okay, let's look at some alternative treatments other than medication for extreme cases of certain disorders such as depression. First of all, we have electroconvulsive therapy, and it involves brief electrical pulses that are applied to the brain that that are meant to produce a seizure within the person, which typically lasts about a minute or so. So, you know, they apply these electrical pulses, and it causes the person to actually have a seizure. And nowadays when they do this, the person is under, so they don't even remember going through this, and they have safety. They have all sorts of safety measures in place. It's become a much more safe procedure than it was, when it was first ever used. Um, and anyways, what we've discovered is that you know, doing doing this helps to ward off depression, and especially especially severe depression that has not been responsive to medication or has not been responsive to psychotherapy. Uh, no one goes and tries this first. People take drugs, and if they don't work, maybe they seek therapy, and if that doesn't work, this is another alternative. And I've talked to somebody that's gone through this, and they love it. They say that just it makes them feel so much better when they have a session. And the person I talked to typically went twice a year, because one treatment's not going to cure your depression forever. It needs to be done once or twice a year. Um, and but apparently it can really work for many people. Um, okay. Um, Another alternative treatment is transcranial magnetic stimulation, or TMS. And in this treatment, a device is placed over the head, which sends strong magnetic pulses through the skull to stimulate the cerebral cortex. And in fact, it will interrupt function in specific regions of the brain. So you're actually going to send these pulses down, and you can actually kind of turn off some clusters of neurons in the brain. And it is another alternate technique that's used to treat severe depression. And finally, we have the third alternate treatment is called deep brain stimulation, or DBS. This is a surgical procedure that involves implanting electrodes in the brain, which then send electrical impulses to specific brain targets. This procedure was originally developed to be used for Parkinson's disease, but now it's used to treat OCD, obsessive compulsive disorder, major depressive disorder, and also anorexia nervosa. It's the same technique in each disorder, but different brain regions get targeted. So it would be a different brain region if you're treating depression versus OCD, but the same procedure. So a little device just gets surgically implanted in your brain, and you have a little pulse generator that sends pulses to that part of the brain just to keep stimulating it. Okay, and that will conclude learning objective 6.